And so with that, the panelists will begin their remarks, and we're going to start with Dr. Couper. Yes.
Thank you, Beth. I've been in practice in medicine in Portland for almost 23 years. I'm a member of the leadership board in Maine of the American Lung Association. I've been active in the American College of Physicians, teaching medical students through the Tufts Maine Med program. And my family history is remarkable for 3 grandparents dying of lung disease, and my daughter and I both having asthma. And so it's made me really professionally and personally very aware of lung issues and healthy air in the state of Maine. And as you can see from this graphic, climate disruption is affecting our health in a number of significant ways through high heat, ozone pollution, forest fires, and an extended pollen season. This all contributes to worsening lung function, acute asthma attacks, respiratory infections, heart attacks, and premature death. It leads to missed days at work and school and decreased productivity. According to the CDC, Maine has one of the highest rates of asthma in the country and a high rate of lung cancer. And even adults who come to work or recreate outside can be harmed. Coal-fired power plants are the nation's single largest source of carbon pollution, and carbon is one of the leading causes of climate change. And we owe it to the people of Maine to act on this. Clean Power Plan sets the first ever limits on carbon pollution from existing power plants. And the American Lung Association is urging the EPA to put strong carbon standards in place by June of this year. Ozone is one of the most pervasive air pollutants, and there are thousands of medical studies that show breathing ozone is dangerous to human health. The studies show harm occurs at levels far below what is currently considered safe. On this slide here, you can see the lines represent different standards, and if you set the standard at the current rate of 60 parts per billion, the top line, you can see that there's far more unsafe days due to hot air. And the American Lung Association is urging the EPA to adopt standards that are based on scientific evidence and lower the ozone limits from 75 to 60 parts per billion. And I would like to thank Senator Collins for all of her efforts to support the Clean Air Act, the introduction of the CLEAR Act and the Super Pollutants Act, and to efforts to find bipartisan solutions to safeguard our environment, combat climate change, and promote clean energy. Thank you.